Today we are going to discuss the bony features and attachments on ulna. Ulna is the long bone of forearm, the present on the medial side. The lateral bone is radius, which we have done in another video. So this is ulna. First of all, we'll discuss how to determine the side of this bone. As all long bones have an upper end, a lower end, and a shaft. In case of ulna, the head is present on the lower end. The upper end is like this with a notch in front. So the upper end is like this. This notched area is called the trochlear notch. It is on the upper end of ulna, and this notch is facing forwards. Now coming to the lower end has a head and a styloid process. The styloid process is facing posteromedially. So if we place it like this on the right side, this can't be the bone of the right side, because if we put the styloid process posteromedially, the trochlear notch is facing outwards, which is not the case. So the trochlear notch should be facing forwards, and the head should be facing laterally, and the styloid process should be facing posteromedially. So this is the bone of the left side. Plus, this sharp introitious border should be facing laterally towards the radius, because the introitious membrane has to be attached on this border of ulna and on the medial border of the radius. So this is the bone of the left side. Now coming to the general bony features of this bone, the head has two processes and two notches. This one is the olecranon process, the large one, and this is the coronoid process, the small one. So the olecranon process has various surfaces. It has an anterior surface, this which is forming the upper part of the trochlear notch. Then it has a posterior surface, this one, which is subcutaneous. Then it has a superior surface, this one, which has a roughened area on the posterior side of the superior surface. Then it has a lateral surface, this one, and a medial surface, this one. Now coming to the coronoid process, the coronoid process has this superior surface, which is forming the lower part of the trochlear notch. Then it has an anterior surface which ends into the ulnar tuberosity. This triangular area is the ulnar tuberosity. Then it has a lateral margin having this radial notch where the radial head articulates and forms the superior radio-ulnar joint. This one is the radial notch articulating with the head of the radius. And on the medial side, this is the medial margin of the coronoid process. Now the two notches are the trochlear notch and the radial notch. So this is all about the upper end. Plus one more thing, on the medial side there is a crest called the supinator crest. This is the supinator crest where supinator muscle is attached. Now coming to the lower end has a head facing laterally and a styloid process facing posteromedially. Now coming to the shaft has three borders and three surfaces. This one is the anterior border of the shaft. This is the posterior border of the shaft, and this one is the lateral or interosseous border of the shaft. The surfaces are the anterior surface between the interosseous border and the anterior border, then the medial surface between the anterior border and the posterior border, and finally the posterior surface between the interosseous border and the posterior border. So this is all about the bony features of ulna. Now coming to the attachments on this bone, first of all we'll start from the upper end. The upper end has attachment of triceps on the posterior roughened area on the superior surface of the olecranon process. Triceps is attached. Then the coronoid process has this anterior surface which gives attachment to brachialis muscle till the ulnar tuberosity. Then on the medial margin we have the supinator crest which gives attachment to the supinator muscle. Posterior to this, on the lateral surface of the coronoid process, we have olecranon process, we have attachment of enconius muscle. Now coming to the medial margin of the coronoid process, we have attachment of two muscles, the flexor digitorum superficialis and the pronator teres. Now coming to the shaft, we have huge attachment of flexor digitorum profundus muscle. It starts from the upper two-thirds of the anterior surface, going towards the upper two-thirds of the medial surface, and finally it is attached to the posterior border. In addition to flexor digitorum profundus muscle, the posterior border also gives attachment to the extensor carpi ulnaris and flexor carpi ulnaris muscle. Now coming to the posterior surface is further subdivided by an oblique ridge into an upper surface and a lower surface. And the lower surface is further subdivided by a vertical ridge into a lateral part and a medial part. So the lateral part has three muscles attached to it. From above downwards, these are the abductor pollicis longus, the extensor pollicis longus, and the extensor indicis muscle. Now coming to the lower end of the anterior surface, we have attachment of pronator quadratus muscle. The styloid process gives attachment to the ulnar collateral ligament. The radial head articulates with the ulnar notch on the radius to form the inferior radio-ulnar joint. This is all about the ulna. Thank you.